because a practice will gain the greatest attention in social media, the greatest disruption that will lead to attention when can differentiate the greatest from the other practices. If I have ABC physical therapy that says, Maitland trained, come to me, I'm doing the best manual therapy. And then right next door, you have the XYZ physical therapy that says, Mackenzie trained, come to me, I'm the best. The differentiation there between Maitland or Mackenzie, the differentiation factor is so minimal. So that will lead then to a money game. Who will be able to spend the highest amount of money to differentiate, let's say, as a Maitland practice versus the practice next door, which is Mackenzie, that spends only $200, while the Maitland trained practice spends $2,000 in Facebook ads. But when you have a differentiator factor, something that can make you totally unique, then the attention goes there. Panetta is not putting right there somebody mobilizing the shoulder, because every other PT and every other chiro shows the mobilization of the shoulder or of the neck in those images. She puts on an MSK ultrasound that is so unique for physical therapy, or an EMG that is so unique for physical therapy, and gains attention. So that is the differentiator factor. That is what sets you truly apart from other practices. And yes, some practices have a great niche. I don't know, maybe women's health or something where only few practices do. But diagnostics really is a disrupting factor in social media when you market a physical therapy place. And we have been able to capture really a huge amount for patients marketing that.
The interesting thing, Dimi, is that we weren't really marketing ultrasound.
Yeah.
What we were marketing was that a person had shoulder pain, because the person, they don't know ultrasound, Maitland,
sure.
They don't know any of that. They don't even care. They don't care. They have shoulder pain, and like we were marketing, I can see your pain. I can see inside your shoulder. Come on in, let me take a look. And that, I think that when you look at it, it was about the patient. The patient had shoulder pain. The unique thing was not anybody else had anyway. Nobody else had magic goggles to look inside the shoulder. You know what I mean? So that's the cool thing. I don't even know if we used the word, we certainly didn't say MSKUS.
Yeah,
we can see inside your shoulder, and we gave them a glimpse of that. Yeah. And that's, people were like, my shoulder hurts. Nobody can see. Oh my God, you can see. Once we got them in, we could then show them, okay, there's your pain. Let me find the underlying cause, which is what we all do so amazingly well. It was just, it's like, how do I communicate? The person's like, no one understands my pain. No one can see my pain. So I think that that's the important thing, is that it's like getting to the level of where the patient is, right, Dimi?
Great. I totally agree with you. It is, on the one hand, you are approaching the patient's problem. What is their condition? The shoulder pain, the knee pain, the back pain, the neck pain. And then visually you show them something that acts as a disruptor. It's not right. Just you have back pain. Okay, we're going to fix it. Right. And it shows the image of someone with a red pain symbol in the back or something. That we have all seen that. Right. You show them something that is different, that disrupts really and brings attention to it.
I know we're almost over, but I just have to, just one little thing, Dimi, to piggyback on you guys, because I actually wrote this down and I'm glad you brought it up. The ultrasound tool that, I mean, we have utilized this this skill as well to get people into the clinic, to show them that we can help them, because they don't think that we can help them. But the differentiator is having something that they can't Google. Google is one of our biggest competitors, right? Google, what do I do for shoulder pain? Top 5 exercises for shoulder pain. How much time do I ice my shoulder when I have shoulder pain? What blah, 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 right? We need to be able to provide them something of value like MSK that they can't Google. And that is our opportunity to show them what we can do as physical therapists. So that's one of the ways that I educate my staff on kind of how we use it and to get people into the clinic from that way. So I just wanted to share that.
Yeah, and I would just say that, you know, if there are people on the line that don't utilize diagnostic testing right now, talk to Demi. Like, what it will open your eyes. Like, I have second generation in the clinic, and I just feel like it's where our profession for physical therapy needs to go. It needs to be part of every training program. And if you're nervous about learning all these techniques, they have it hands-on. Diagnostics has it hands down, a simple path for you. I graduated in the 80s and I made it through. So I feel like you will learn.
If Joe made it through, you guys can do anything over there.
I know. So I'm just like, they will hold your hand from the minute, you know, it is, every therapy practice should have this as part of their practice. And, you know, HODS is definitely the group that can help you move through to becoming completely 100% competent, certified. And it's just, we can help so many more people with all this new technology for sure. So.
Yes.